Hello, dear friends. Have you ever found yourself settling into your favorite chair, perhaps with a good book or to watch a beloved television show, and hours just seem to melt away? It's a common comfort, isn't it? Especially as we enjoy our golden years. But what if I told you that, for those of us who have celebrated our 70th birthday, or are approaching it, this seemingly harmless habit of prolonged sitting could be silently, and sometimes irreversibly, harming a very crucial part of our bodies? Yes, I'm talking about our hips. Today, I want to have a gentle, open conversation about why sitting for too long after the age of 70 can be particularly risky for our hip joints, and most importantly, what we can do to protect them. Think for a moment about everything your hips do for you. They are the central pillars supporting your upper body. They allow you to stand tall, to walk with grace, to bend, to climb stairs, and to engage in so many of the activities that bring joy and independence to your life. Healthy hips are truly fundamental to our mobility and our overall quality of life. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 10. If you don't like it, comment number 0 to let me know so I can make a better video for you. Now let's get started. So why does prolonged sitting become such a concern specifically after 70? Well, as we journey through life, our bodies naturally undergo changes. After 70, it's common for muscle strength to gradually decrease. Our bones might also lose some of their density, a process often related to calcium loss. These are natural aspects of aging. However, when we sit for extended periods, these physiological changes can unfortunately amplify the stress on our hip joints. Muscles that support the hips, like the glutes and hip flexors, can weaken from disuse. The reduced muscle support means more direct pressure is placed on the hip joint itself. Imagine a bridge. If its supporting cables weaken, the bridge structure takes more strain. It's similar with our hips. Another very important factor is blood circulation. Our circulatory system is like a network of rivers, bringing vital nutrients and oxygen to every part of our body and carrying away waste products. When we sit for long stretches, especially after 70 when circulation might already be a little less robust, the blood flow to and around our hip area can be significantly reduced. This means fewer nutrients reach the joint tissues, and metabolic waste products, which can cause inflammation, are not cleared away efficiently. This chronic, low-level inflammation can, over time, contribute to the degeneration of the hip joint cartilage and other structures. Now you might be wondering, what does this irreversible damage actually look like or feel like? It's important to recognize the signals your body might be sending. One of the most common signs is pain in the hip area. This could be a dull ache or a sharper pain, especially when you get up after sitting for a while, or when you're walking. You might notice a feeling of stiffness in your hips, particularly in the morning or after periods of inactivity. This stiffness can make it difficult to move freely. Your range of motion might also become limited. Perhaps you find it harder to lift your leg, to cross your legs, or to perform simple tasks like putting on your socks and shoes. These symptoms can start subtly, but if the underlying cause, often related to prolonged sitting and lack of movement, isn't addressed, they can worsen. The consequences of letting these issues progress can be quite serious. What might begin as occasional discomfort can evolve into chronic hip joint dysfunction. This can profoundly impact your daily life, making it challenging to walk, to climb stairs, to get in and out of a car, or even to sleep comfortably. In more severe cases, this can unfortunately lead to a significant loss of independence and, in some instances, contribute to a greater risk of falls, which can have devastating outcomes for older adults. It's a sobering thought, isn't it? But please, my intention is not to alarm you, but to empower you with knowledge, because there is so much we can do to prevent these problems and to manage them if they've already started to appear. Let's talk about prevention first, because it's always the best medicine. The most straightforward piece of advice is to simply avoid sitting for very long periods at a time. Try to make it a habit to get up and move around every 30 to 60 minutes. Set a little reminder on your phone or a kitchen timer if it helps. When you do stand up, you don't need to do anything strenuous. Just walk around the room for a minute or two, stretch gently, or even just stand while you watch a bit of television. When you are sitting, pay attention to your posture. Try to sit upright with your back supported and your feet flat on the floor. Avoid slumping, as this can put uneven pressure on your hips and spine. Now, what if you're already experiencing some discomfort? Gentle exercise and movement are key. Activities like slow, mindful walking are excellent. Walking helps to maintain joint mobility, strengthen supporting muscles, and improve circulation without putting excessive strain on your hips. Specific, gentle hip stretches can also be very beneficial. Think about slow leg raises while holding onto a chair for balance, or gentle hip circles. Always listen to your body. These movements should feel like a comfortable stretch, never painful. If you're unsure, a physical therapist can be a wonderful resource. They can assess your specific situation and recommend exercises tailored to your needs and abilities. And critically, if you are experiencing persistent pain, stiffness, or a noticeable decrease in your ability to move, please don't delay in seeking medical advice. Your doctor can properly diagnose the cause of your discomfort. It might be related to osteoarthritis, bursitis, or other conditions that can affect the hips. Early diagnosis and a proper treatment plan, which might include lifestyle modifications, physical therapy, medication, or other interventions, can make a significant difference in managing the condition and preventing further damage. So, to bring it all together, our hips are precious, and they deserve our care and attention, especially as we navigate our 70s and beyond. Prolonged sitting, while seemingly innocent, can indeed pose a silent threat to their health, leading to discomfort, reduced mobility, and potentially irreversible damage. But the power to protect them lies largely in our hands, through conscious choices and simple habits. I invite you, today, to reflect on your daily routines. Are there small pockets of time where you can incorporate more movement? Can you make it a point to stand up and stretch more regularly? Let's make a pact with ourselves to cherish our mobility. Let's stand up for our hip health. By making these small but consistent changes, by listening to our bodies, and by seeking help when we need it, we can continue to enjoy active, fulfilling, and independent lives. Take good care of yourselves and take good care of those wonderful hips.